The topic I'll be speaking about today is the global water crisis. So when I first learned of the global water crisis, I was absolutely shocked at simply the sheer magnitude of people suffering without clean water. Now, I'll be providing a lot of statistics in this talk just to show you how I think that this issue is one of the most pressing problems in the world today. All of us essentially have a supply of clean water at the pull of a lever. We all take drinking water for granted, but most people don't truly realize how much water the average family uses overall. According to the US Environmental Protection Agency, the average American family uses more than 300 gallons of water per day at home. Roughly 70% of this use occurs indoors. You can live 3 weeks without water, but only a few days without, you can live 3 weeks without food, but only a few days without water. And it's not just humans that need water. Every biological living organism, from ants to plants and microscopic bacteria, needs water to survive. It may sound impossible, but there are absolutely no exceptions to this rule. This is why that when NASA is looking for evidence of life on other planets, scientists actually first start by looking at evidence for water. Having said all this, it's truly unfortunate that nearly 1 billion people around the world don't have easy access to clean drinking water. Now imagine that. There's a billion people, which is 1 followed by 9 zeros. There's literally a seventh of the planet constantly suffering without proper water, the most basic amenity that should be available to all. According to the World Health Organization, contaminated water can transmit diseases such as diarrhea, cholera, dysentery, and typhoid. As a result of this, millions of people die every year from a lack of water and contaminated water-related diseases. That's more than the global deaths of HIV, AIDS, and malaria combined. This is why the global water crisis is in fact a dire health crisis. Nearly 1 million people die each year from water, sanitation, and hygiene-related diseases, which could be reduced with access to safe water or sanitation. Every 2 minutes, a child dies from a water-related disease. Access to safe water and sanitation even contributes to improved health and helps prevent the spread of infectious diseases. It means reduced child and maternal mortality rates, and it also means reduced physical injury from constant lifting and carrying heavy loads of water. As we face the COVID-19 pandemic, now more than ever, access to safe water is critical to the health of families around the world. So the greatest issue correlated with the lack of clean drinking water is diseases. As I mentioned before, contaminated water and poor sanitation are linked to the transmission of diseases. Absent, inadequate, or inappropriately managed water and sanitation services expose individuals to preventable health risks. This is particularly the case in many healthcare facilities in developing countries where water is most necessary, including places like Libya, Yemen, Jordan, India, and dozens of more countries. Both patient and staff members at these healthcare facilities are placed at additional risk of infection and disease when water, sanitation, and hygiene services are lacking. Globally, 15% of patients develop an infection during a hospital stay, with the proportion much greater in lower income countries. Inadequate management of urban, industrial, and agricultural wastewater means the drinking water of hundreds of millions of people are dangerously contaminated or chemically polluted. And because of these conditions, some 829,000 people are estimated to die annually just from diarrhea as a result of unsafe drinking water, sanitation, or hand hygiene. Yet diarrhea is largely preventable, and the deaths of nearly 300,000 children aged under 5 years could be avoided each year if these risk factors were addressed. Where water is not readily available, people may decide hand washing is not a priority, thereby adding to the likelihood of diarrhea and other diseases. So diarrhea is the most widely known disease linked to contaminated food and water, but there are other hazards as well. In 2017, over 220 million people required preventative treatment for schistosomiasis, which is an acute and chronic disease caused by parasitic worms contracted through exposure to infested water. In many parts of the world, insects that live or breed in water carry and transmit diseases, such as dengue fever. Some of these insects, known as vectors, breed in clean rather than dirty water, and household drinking water containers can also serve as breeding grounds. The simple intervention of covering water storage containers can reduce vector breeding and may also reduce fecal contamination of the water at the household level. So as you can see, water can be easily contaminated and disease can spread so easily to thousands and even millions of people around the world. An amazing solution to this crisis was inadvertently created by Philip Suter, a laundry scientist who was actually trying to discover a way to separate dirt from used laundry water. This innovative solution was the P&G water purifier packet. So the process of this water purification follows in three major steps. The first step is coagulation. Then comes flocculation. And finally, the last step is the disinfection of the water. So when you have dirty water, there are several different kinds of contaminants that the powder works to dissolve. So first, as the powder is released into dirty water, the coagulant in the P&G powder gets to work. The coagulant are actually tiny seed crystals that are positively charged. And these positively charged seed crystals are used for eliminating dirt, since the dirt particles are negatively charged, and they're attracted to the positively charged coagulant. So when they clump together into pellets about 1 millimeter in size, they become larger and more dense. The next part of the powder is a flocculant, in which the polymers wrap up clumped dirt pellets into larger aggregates. Now the clumps of dirt and coagulants are even bigger and are actually denser than water, enabling it to sink to the bottom. Finally, the last step of disinfection is a time-delayed chlorine release, which kills 99.999% of pathogens like bacteria and viruses that causes disease in contaminated water. Since 2004, millions upon millions of people have used these packets to save thousands of lives in over 90 countries. Since over 785 million people don't have access to clean drinking water, chances are that they spend most of their day just trying to find clean water. This leads me into my next point of how water also prevents education and economic growth. When water comes from more improved and more accessible sources, people spend less time and effort traveling for miles and miles just to collect it. This means that they can be more productive in many other ways. This also results in greater personal safety by reducing the need to make long or risky journeys to collect water. Better water sources also mean less expenditures on health, as people are less likely to fall ill and have exorbitant medical costs. They are also better able to remain economically productive. According to water.org, time spent gathering water or seeking safe sanitation accounts for billions of dollars in lost economic opportunities. $260 billion is lost globally each year due to lack of basic water and sanitation. Access to safe water and sanitation at home turns time spent into time saved. This means that families have more time to pursue education and work opportunities that will help them break the cycle of poverty and even boost the country's economy and GDP as well by gaining jobs. Now, the water crisis, like I said, is an educational issue since it not only kills millions every year, but it also is it truly is a huge waste of untapped brain power. When these P&G purified packets were manufactured and distributed throughout developing countries, it allows families to stay healthy and have more time to provide for themselves financially. In turn, this gives their children opportunities to get further education and provide for more for the following generations. So eventually, over time, the world would be reaping benefits of developing countries and possibly new breakthroughs in technology, or even the cure to diseases such as HIV or cancer could come from a poor and developing country. And I think that's an amazing and worthy goal of achieving. Thank you so much for your time, and thank you for this amazing opportunity.